Ontario's Chief Medical Officer of Health confirms what doctors and epidemiologists have been saying for weeks. This province is in a sixth wave and could be until the end of May. But the government is not going back to mandatory masking. Instead, it is strongly recommending them.
I think it really comes down to common sense. We've been through this for 2 years. When you walk into a real crowded room, throw the mask on. No one's going to force you, but I would recommend it. Just put the mask on.
In his first news conference in over a month, the Chief Medical Officer of Health said up to 6 million Ontarians have had COVID since December, and people need to assess their own risk before going out.
The data has been available to all Ontarians.
Not really. With limited PCR testing, there was no way of telling how many cases were circulating. The Chief Medical Officer of Health did not put out a warning, nor did the Health Minister or the Premier. It was Dr. Peter Uni from the Science Table who said last Wednesday cases had risen to 100,000 a day. The good news, though, according to Dr. Moore, is that despite the high number of cases, hospitalizations are not dramatically rising.
We're not seeing the same ratios that we saw in previous strains of, we used to have, for every 100 patients, we'd have one admitted. We're not seeing that because of the benefits and strengths of immunizations.
As cases soar, though, calls to make masks mandatory in schools again have been growing among doctors, epidemiologists, and Public Health Ontario. Dr. Moore maintains the risk to children is low.
We've not seen any significant threat to the health of children. Of all of Ontario, 2.75 million children, there's 2 in the intensive care unit right now.
Dr. Moore believes this wave will last 4 to 6 weeks, which means it will be the backdrop to the provincial election on June 2nd.
The reason that we're not at mask mandates right now is because part of Doug Ford's voting coalition doesn't want them.
Both the provincial Liberals and NDP are calling for mandatory masks in schools and other essential locations, like grocery stores and pharmacies.
1 in 7 students and teachers were absent last week. We have, it's running through our schools.
Today, the government announced it's expanding PCR testing to high-risk people, including anyone over 70 and those 18 and over who are immune-compromised. It's also going to make Paxlovid, an antiviral drug for high-risk people who test positive, available in pharmacies as of tomorrow. In the meantime, here is the Premier's message.
I stress to everyone, be cautious. Be cautious.
Now, masks are still mandatory in hospitals, long-term care, and on public transit. That order is supposed to expire April 27th. However, today Dr. Moore said it makes tremendous sense to extend it.